Hello everyone, I'm Dr. Rekha Bansal. I'm a consultant medical oncologist. I'm practicing at Apollo Hospitals, Jubilee Hills. Breast cancer is the most common cancer in the world and in India. Unfortunately, we are seeing more and more cases of breast cancer. So it is very important to learn about breast cancer because it is one of those cancers for which screening methods are available, and if it is detected early, it can be cured. So when it is detected in stage 1, the earliest possible stage, then the cure rate can be as high as more than 95%. So that is the whole idea about promoting awareness for breast cancer. So what happens more often is women think that if there is no risk factor in them or in their family, if no one in their family suffers from breast cancer, then they will never get breast cancer. But unfortunately, it is not true. Each and every woman is at risk of breast cancer. Yes, of course, if there is family history, the risk automatically increases. And if there are many other risk factors, then the risk increases too. So let us look at what are the risk factors. Some of the risk factors are age itself. Increasing age itself is a risk factor. Nulliparity, not having children, not breastfeeding is a risk factor. Use of oral contraceptive pills, irrational use when not prescribed trained gynecologist or taking them over the counter is risk factor. Obesity is a risk factor. Consumption of alcohol and smoking is also a risk factor. So by avoiding some of these risk factors, you're automatically decreasing your risk. If there is a genetic history, if there is a family history and there is a genetic predisposition, if a BRCA1 or BRCA2 mutation is identified, then also the risk is increased. So how do you curtail this risk factor? One is to maintain a healthy lifestyle, avoid smoking, avoid alcohol, being active, avoiding irrational use of OCPs. By this, you can reduce your risk. Apart from that, if there is a family history, then you have to follow the screening protocols for a high risk individual. For an average risk individual, the protocol says, the guidelines say that annual mammogram above the age of 40 years is enough to detect them early. If at all there is a family history, then the screening begins at the age of 25 years. We start with MRI at that age. MRI breast is to be done. So what are the symptoms of breast cancer? Some of the symptoms of breast cancer are feeling of a lump, or you might notice a change in the size or shape of the breast. There could be discharge, nipple discharge. More often, it is bloody nipple discharge in case of a breast cancer. There could be changes on the skin. There could be skin dimpling or redness that you might notice. Also, there could sometimes be lump in your armpits. So all these are some of the symptoms. Now, presence of a symptom doesn't automatically mean that there is breast cancer, but whenever you find any of this symptom on you, that means you need further evaluation, further testing by a trained oncologist. Not all breast cancer are same. Not all breast cancer patients are same. So every breast cancer patient is unique, and there are different types of breast cancer. So we need to identify what is the type of breast cancer the patient is suffering from, and every individual might have different response, side effects to the treatment protocols. So breast cancer could either be triple negative breast cancer, which is known to be the most aggressive type of breast cancer, or it could be HER2 positive breast cancer or hormonal receptor positive breast cancer. So if it is HER2 positive breast cancer, then we treat with targeted therapy. And if it is hormonal receptor positive breast cancer, then anti-hormonal therapy automatically becomes part of the treatment. Now, in early stages, almost all the patients, they require surgery, chemotherapy, radiation therapy at some point of their treatment journey. Now, the sequence could be different. It depends on the patient profile. It depends on the tumor profile. For a stage 4 cancer patient, generally there are very good treatment options available as of today, even for a stage 4 breast cancer patient. It is not a death sentence. We have patients living beyond even 4-5 years and leading their lives normally. So our goal is to diagnose it in earliest stage possible, that is stage 1, where the cure rate is very high. It is more than 95%. One of the easiest ways to detect breast cancer early is to be aware of the symptoms, what to look for. So you need to be aware of how your body feels and looks normally. So at the end of your menstrual cycle, every lady, every woman should self-check, check for any lumps on you. So every month this needs to be repeated. Only when you know how your breasts look and feel normally can you detect any changes. And once you have found a change, let's say you do notice some change, do not hesitate, do not hold back, do not think it will just go away. So breast cancer is not to be feared, but it is to be understood. So once you understand, the process is simple. So once you find something, you get yourself tested. Even if it turns out to be cancer, there are good treatment options available and you can be cured. So it is not to be feared, but understand, be aware of what symptoms to look for. Once you do notice something, do not keep delaying it. Do not automatically think it will just go away, or do not fear that what if it turns out to be cancer. And so many of my patients tell me that they were just scared and that's why they didn't reach out, that's why they didn't seek help earlier on. So let us not do that. Let us talk about it more freely. I think every lady should be able to discuss about breast cancer, and especially if you're above 40, make sure you have had your mammogram.